After 50 years of research into counselling, what exactly works? What are the magical ingredients that actually have this really positive impact on people's lives? So there's 4 ingredients, and they call them the common factors. And they call them these because in counselling there's really this movement towards having many different models and theoretical frameworks and everything. And what they discovered, that it wasn't the differences in all these models that makes them work, it's rather what they have in common that actually makes them work. And they're pretty sensible things, the common factors. One is hope and expectancy and optimism. When those are present when you're working with somebody, they're likely to do a lot better. So they're kind of like magical ingredients. And if they're not present, it's likely they won't do as well. So that's the first common factor. The second common factor is relationships. When somebody you're working with, when they feel understood and respected and supported and they feel accepted and you have a therapeutic relationship with them, again, when that's present, it's another ingredient, another magical ingredient that really tends to help people to do a lot better and to get great outcomes from the work you do together. And again, if that's not present, things may not go as well. So another common factor is the structure, the model you use, the way you work together. It's important that there is a structure, that there is a way of understanding the problem that makes sense to both of you and that you're working together towards making progress in. It's not so important which specific model you use or which specific structure you use. What's really important is that that structure makes sense to the person you're working with, that they really get it. Whatever approach you're taking, that really connects with them. And there's lots of different approaches. And the key is it's an approach that really connects with the person you're working with. And different approaches will work for different people. And again, the thing is, if you're using an approach and it doesn't really make sense to the person, it doesn't really connect with them, and they don't really believe in it, again, it's likely to be less effective. Whereas whatever way you're working with them, if it kind of makes sense to them, it connects with them, it seems like a good fit for them, then again, you're likely to get better outcomes. And the last common factor, the most significant one, ironically, it's the extra therapeutic factors, client factors. It's kind of everything that has nothing to do with the work that you do. Because if you think about it, you just spend a small amount of time with them anyway, and everything else has a huge impact for healing and helping them move forward. And really these are the client's strengths and the resources they have and their understanding of how change happens in their lives and what they're bringing to the process. These are the most significant factors. And again, for every individual, those are going to look a little different. But that is the biggest factor in helping people move forward. And that can be, chance events in their lives sometimes. It can be meeting a new friend. It can be getting back into a hobby they had before. It can be some perspective they figured out during the week that had nothing to do with the work that you were talking about, but they just got some new ideas during the week that can really help them. And there's really quite a lot of things that can fit into that category of client factors, extra therapeutic factors. Basically the client's strengths and resources that they bring to their process of healing are the most significant factor for change.